Well, hello everyone. My name is John Vick. I am with the Tennessee Department of Health. I'm the interim director of the Office of Primary Prevention. I'm going to talk a little bit today about the Tennessee Livability Collaborative. This is our state health and all policies initiative in Tennessee. It is definitely not the only way that we do health and all policies at the Tennessee Department of Health. It's a way, not the way, but it's one that I co-facilitate along with Leslie Meehan. It's, I think, a really interesting model. Oh yeah, am I not enough? Is that better? All right, did you hear anything I said? Okay, great. All right, so I'm going to talk a little bit about the collaborative as a way, not the way to do health and all policies, but it's a model that's worked well for us. I do want to acknowledge that the department is doing a lot of other things like HIAP outside of this before I talk about it. We have county health councils in every county in Tennessee that the department helps to support and build the capacity of. We also have healthy development coordinators who work in local communities across the state as advocates for building healthier built environments. And then we also have a health disparities task force at the state level out of our Office of Minority Health and Health Disparities. So we have a lot of other initiatives going on as well. But the Tennessee Livability Collaborative has been around for about 6 years. It started off as a conversation between 4 departments, including the Department of Health, who agreed that there was value in us getting together regularly and talking about opportunities to collaborate and align the work that we do, because so much of what we do as state government agencies is really working toward the same goals and the same end. So how do we make sure that we're not working in silos? How do we make sure that we're identifying those opportunities for collaboration and that we see our goals as shared goals? So it started off with 4, we're now up to 21. We are a voluntary group. We were not created through executive order or legislation like many HIAP initiatives. It started with a conversation. Nobody's required to attend, but we've had consistent attendance. We tend to have between 20 and 30, sometimes more people attend every other month when we meet in person. It is a working group, but we don't always take on big initiatives. A lot of what we do is talking about the work that we do and identifying opportunities for collaboration. We don't have any funding. There are 2 of us at the Department of Health that facilitate the group, but we don't have any dedicated staff other than that. We don't have any funding, which is both a good and a bad thing in different ways, and I can talk a little bit about that if people are interested. But so we've been together as a group for a while now. At the 3-year mark, we decided to do an evaluation of the group to see if we were accomplishing our goals and to see if there was value in having a group like this that met regularly. What we found through that evaluation is that we were seeing increased collaboration among the agencies that were part of it. We have dozens of examples in the evaluation report. That's online. If you Google Tennessee Livability Collaborative, you can find it there. So lots of different examples of departments collaborating on projects, reaching out to one another to participate in events or in assessments or producing reports. Or partnering on programs and funding. So a lot of great examples of concrete examples of collaboration that happened, maybe not necessarily solely because of the collaborative. It's tough to attribute some things to just one effort alone, but certainly many people identified the collaborative as either being the sole reason or a contributing factor in a lot of those collaborations. There's been a lot of talk about mindset. I think that's been really important for us. As we've worked together as a group, the evaluation also found that people felt a more common sense of shared purpose and a better interconnectedness between the work that we were each doing as state departments. We also did create some unique initiatives as a group. I'll talk a little bit about those in just a moment, but I did want to mention too, so we have mostly just state agencies, departments, and commissions, and we then have also 3 academic partners that are part of it. This is just solely for public state entities. Part of that is, I think this was mentioned earlier by someone, it's kind of a safe space for us to really talk about the work that we do and vet ideas, talk about challenges that we have. So we've limited it to that for now, but we could certainly open up the group in the future, and I think there are lots of benefits to doing that as well. One of the things that we are currently working on as a group is creating a set of livability indicators for the state. So I haven't really talked about the term livability. You'll notice we don't call our initiative a Health and All Policies initiative. We don't lead with health. And part of that is because we've worked very hard to create a neutral space where everyone can come together, and it's not something that you're doing for the Department of Health. It's something that we're all doing for one another. And so everybody sort of sees how their work relates to this concept of livability. There's no Department of Livability, but we all see how we touch that and are trying to work toward that. So that's why we call it the Livability Collaborative instead of a HIAP initiative. And I loved Jimmy's diagram where he had housing in the center, because I think what we're really trying to do is kind of an informal version of that, where everybody sees themselves as the center of the diagram in our group. So we did identify as a group some opportunities where we felt like we could be impactful. One of those was thinking about service utilization. We have a lot of resources in state government, and many of those are underutilized, especially by communities and people who need them the most. So one of the things that we did early on was engage local stakeholders in two distressed counties in Tennessee, economically distressed counties, to work through our Department of Economic and Community Development as they were developing their community and economic development plan. They're called 3-star plans. We actually brought at the time all 12 agencies that were a part of our group out to those communities in person. We listened to what their priorities were and what action steps they had as part of their plans. And we talked about what resources we had available that could help support the implementation of those plans and build relationships between state government and local stakeholders and communities. So just one example of something we've done, I'll go back to the livability indicators. So one of the things we identified early on as a group when we developed our theory of change was that we wanted to make data more accessible, and we wanted to have a publicly available data source for the state that touched on all the different things that relate to livability. So we've been working hard as a group on creating a set of indicators. Some of those are internal to state government. Some of them are produced by other entities outside of state government. We have about 120 indicators in our list so far that we're working to vet. But the idea is that we'll make those publicly available, and that we would like to share them in a way that puts data in context. So this came up earlier. Sometimes the data can misrepresent things. We've talked a lot as a group about wanting to make sure that we have indicators that really are things that we can impact, but then we can also put them in context and tell stories alongside the data, so that it's not just numbers, but it's something that includes both qualitative and quantitative data and stories around issues across the state. So we're working on those. Hopefully they'll be publicly available soon. We've actually already started using those indicators to inform our current state health plan, which we're working on right now. Part of that is an analysis of health across the state, and our current state health plan actually started with that draft list of livability indicators, which collectively really represent what we would call the social determinants of health. It's everything from active transportation to affordable housing to educational attainment, community engagement, a lot of different things. So we started with that list, and then we're able to work through the collaborative members to get their expert opinion on the best indicators for us to measure for the state to look at health, and then also to get a little bit more context for some of those numbers. And again, to build relationships, just the process, I think, of developing these indicators. There are lots of tools out there for looking at data that are available nationally, but we really want to go through the process, because the process itself, I think, has been an important outcome for us to partner, to create something together, to learn about one another's work and priorities. So just an example of something that we're producing as a group beyond just learning in our working group meetings about the work that we're doing, identifying opportunities for collaboration organically. And so I think I'll stop there, but glad to answer questions during the Q&A portion if others have questions about the work that we do. Thanks.
Awesome, thank you, John. John Vick, just to be clear. So I wanted a quick update for the the facilitators for the breakout sessions later. Actually, during the Q&A portion, if you wouldn't mind, start going out to meet with Tracy and Latrice, that would be great. So we're going to pass it now over to Raquel, who had the wonderful question about data. So I'm more excited to hear about some of the things that you're leading here, and go from there.
Sounds good. Hi, everyone. I think I have slides available, but if not, we'll move forward. My name is Raquel de la Huerga. I work for the Health Equity Bureau at the Nashville Public Health Department. And to kind of tell a bit of a story of how we got to some of the work that we've been doing in the health and all policies space, I'm going to give a little bit of history that relates to Tracy Buck, who has helped organize this event, as well as Tom Sharp. Both of them are kind of our veterans at the Public Health Department who have been leading health and all policies work for years now. And most of that has been conversations and convenings of people across Metro government to talk about different issues and talk about what's going on in their spaces. And when the Health Equity Bureau launched at the Public Health Department, which was a little over a year ago, we were brought into conversations about how to build in equity into this process related to what Julia was talking about in terms of health and equity in all policies. We see that fully. And trying to get to a point of how do we make this practical for the people that we're meeting with on a regular basis. In our health and all policies coordinators meetings, we're regularly working with general services, planning, the juvenile court, water, et cetera, and having conversations. And Tracy has done an amazing job in terms of training up those people to understand health and all policies as a framework. And that's what we've talked a lot about today in terms of this theory of how people should get together, how we should be having conversations, what we should be talking about, what should be at the center. And our hope was to create what we're referring to as a tool to kind of make that process easier, because your jobs are already so complicated, whether you work in government, nonprofit, private sector, et cetera. Having conversations about health is difficult, and not everyone's going to go out and get a master's of public health and have a really strong understanding of all of the nuance that goes into this. And so part of our desire was, one, to have more facilitated conversations where the public health department was facilitating those conversations and guiding what was being discussed when it comes to health, but then also training up our peers around Nashville to be able to take the tools that we could give them and move forward in their projects and guide decision-making within their teams to center health. And so the way we kind of have gone about this has been a big trial and error process. We've been at it for about a year in terms of trying to build what we have called the Health Lens tool. And you might be thinking, what do you mean health lens? And that's just a nice way of us trying to frame out what it looks like from a public health perspective to see these issues. And so what we've been talking about today in terms of if you are a housing person, you see housing as the center of everything that you do. And I think there's been really fruitful dialogue of whether or not health should be at the center, and I think that varies, but equity should definitely be at the center. And when it comes to having conversations that are thoughtful about health, it is good to have designated conversations that discuss those issues. And so we created this Health Lens tool that asks questions to kind of get people thinking and to think about issues through a public health lens. And currently, we've actually been testing this project with a couple different partners across Nashville. Anita is actually here today from planning, and we've been doing some testing with her. But actually, our first pilot started with the Juvenile Justice Center here in Nashville. They are working on a project to have a new campus. It's called the Nashville Youth Campus for Empowerment, or NICE. And the intention is to go from their current building that has existed for decades and has not quite been serving the needs of youth and families, especially the youth that are in detention at the moment, and trying to transform it into a space that really can provide the support that is needed to address some of those upstream issues that Julia was talking about when we're talking about not only youth violence and neglect and abuse issues that happen in the family setting, but all of the health implications that surround that, whether it is someone in the family employed, or is someone in the family experiencing a trauma and not getting the help that they need. And so we've gone through using this tool and trying to navigate the conversations that are needed to design a brand new campus that will take a few years to build out, but we have this time to really think intentionally about health in this context. And so there's kind of three pillars of the focus that we have within this tool, but the overarching theme is that we want to promote health, equity, and sustainability. And sustainability is one thing that I do want to mention because I think health and equity have really been talked about a lot. But we also want change that is not just for tomorrow, but that is for 10 years from now, and that we can actually be progressing and having our plans reflect what we hope society to look like and what that vision is for how we want to be. And so the 3 pillars that we've focused on is first having a real conversation of all of the ways that a project can impact health. So that connects to the health impact assessment that was discussed earlier. And part of it is, encouraging people to look at data and look at it through the lens of the social determinants, whether that be transportation or housing. And we also do talk about gentrification and segregation and discrimination and the whole range of issues that are connected to health. And the way that we pose our questions is not just, how are you hoping to change this? How are you hoping to improve in the space of providing health services? How are you hoping to improve access to housing? But also, what are the possible unintended impacts? And this has actually been, honestly, a challenge for us to get to in some of these conversations, because when you're planning a project and you're making a decision, you have this idea of, this is what we want it to look like. We don't often think about all of the things that might get us stuck down the way. And in order to have sustainable change, we need to be thinking about what might happen 5 years from now. What might happen if we present this to city council? What might happen if we have to displace this community and move it somewhere else? What are all of the health impacts that come out in that space that maybe we're not thinking about? And having an in-depth conversation about some of these issues is something that we're trying to toy with in terms of how deep do we go? Because we can go really deep, but also we understand that people, when they're making a decision, sometimes we need speed, sometimes we need efficiency, and figuring out when to pause and also where to prioritize our energy. The second pillar is really focusing on this community engagement that we've been talking about today as well. And so part of it is looking at cross-sector collaboration and asking questions related to who is represented at your table when you are engaging different sectors. Do you have representation from all of government? And when are you engaging them? And when is the right time to pull them into the conversation? And also we're talking about community engagement and really seeing the community as a key stakeholder and understanding that there are also gaps in representation that exist in many conversations, whether that's you're having a town hall and only specific people show up and some people have the loudest voice, or whether or not you're inviting organizations that focus on disability issues, whether or not you're inviting a specific racial community that is going to be extensively impacted by this decision. And so making sure that those who are most impacted have the resources to contribute to the project, have the ideas and the expertise, are invited and are engaged deeply. And that's also one thing we've been trying to look at, is not just getting to the level of we're informing people about this project, but who needs to be leading the project? Who needs to be a collaborator? Who needs to be brought in to the decisions? And then there are also some people where maybe because of time constraints, like the conversation earlier in terms of getting people to come out to community meetings, there are difficulties there in understanding the nuance, but trying to get as much of our community involved in the process so that down the line, and this is again related to that sustainability piece, 10 years down the line, the community isn't saying, this isn't what we asked for, this isn't what we needed, and instead can say, this is exactly what we asked for, and I'm glad my government listened. And the third component is talking about transparency, accountability, and review. And so really looking at how are we building in mechanisms throughout our decision making to look back at ourselves and figure out how we can do better. So that's the review part in terms of how are we evaluating what we are doing, how are we getting the information we need to make decisions that are educated and data informed, and also how are we building in checkpoints for ourselves so that when we get stuck or when the community needs information, we have a plan in that we can use. And so we've kind of compiled different types of tools. The 3 main things that we're focusing on the moment is a checklist just to kind of get an idea of what is going on, and asking simple questions. It's much shorter to fill out. It gives us an idea as the Health and All Policies team of what support might be needed. But then the real meat of our tool is assessments that are done in a facilitated process where there's a lot of dialogue between the decision makers for this project And currently it's us, the public health department, but hopefully down the line, we can get people all over metro government and even in the private sector to be facilitating these conversations and to be able to ask the questions that need to be asked so that this health lens exists where it needs to be, where decisions are being made. And in the last part, we do debriefs. And so these are conversations after the assessment, once we've given them reports on kind of where they're at. We follow actually like the Bloom's taxonomy, which is a way of understanding learning, and kind of having a transparent conversation of where we think the decision makers are in utilizing the health lens and learning how to apply their health lens and providing that feedback so that they can go further to address those upstream conditions or incorporate community needs or build in more accountability. And then in this debrief, we also get feedback, which that's what we're working on at the moment. And part of what I was asked to do as a panelist was to talk about our opportunities as well as our challenges. And so opportunities, we have really cool people working on this project. We have our epidemiology team working on it. We have our policy people working on it. We have our performance evaluation people working on this project. And it has been a learning process, and we provide each other with an endless amount of feedback, and we're still working on it. But the exciting thing is that this is something that we're hoping to adapt. The challenge is it's really hard to adapt a tool to meet the needs of what the decisions are in the community, whether that be just trying to understand all of the decisions going on in planning, which I'm still figuring that out, or to understand how decisions work even outside of government, or maybe at different levels of government, whether that's the state level, maybe it's Metro Council, maybe it's the mayor's office, or maybe it's within an individual department. And so trying to adapt this tool so that it's actually useful for people is something that we are working on, that we want feedback on, and hopefully we can work with the people in this room or the people that you know to try to test it out, to try to provide health feedback on decisions that are being made, and also help us really tailor this tool to work for Nashville's community and work for the health needs that exist here. So yeah, that's what we're working on.
Well, I'm excited to have learned about that, and look forward to learning a lot more. Thank you for all you're doing. I will now pass over to Meg Morgan with Root Nashville, which I'm also very excited to hear about this project and all the trees you're bringing us. Thank you.
Yes, thank you. Can y'all hear me okay? And I do have slides I would love to show, and maybe I'll give like a signal, or does the clicker work? I'll get rolling in any case. My name is Meg Morgan. Oh, wonderful. Yes, thank you. And I am the campaign manager for Root Nashville at the environmental nonprofit, the Cumberland River Compact. Might seem a little out of the box to have an environmental nonprofit here, but it really isn't, as we'll get into. So I'm grateful to Tracy and to Latrice for the invitation to be here. And also, Julia set things up for me very nicely by talking about climate change as our #1 public health threat issue that we are facing. So wanted to start with a little bit of context for this conversation about tree canopy and health. And that is that in Nashville as a city, it is a sad and sobering but very true fact that we are losing trees as a city. We're losing trees to development and to growth. It doesn't help when we have storms like tornadoes and derechos and floods, and by the way, we're only going to have more of those. We have an aging tree canopy overall. Trees live a long time, but not forever. And we also have an invasive insect that is going to kill all of our native ash trees, and that's about 5% of our canopy. So that's something that we should really, really care about, because trees give us so many different kinds of benefits. I'm just going to touch on some of the public health benefits for this audience, but there are so many benefits in addition to these public health benefits. But if you think back to, your middle school science days maybe, or elementary school, remember, of course, that trees provide clean air. And there are study after study that shows that the more trees you have, the greater canopy that you have in an area. The hospitalizations due to asthma decrease. So they're really important for that reason. That map of Davidson County in the bottom corner is called the urban heat island effect. and that is showing that areas with more impervious surfaces, which is a fancy way of saying concrete, are hotter than others. And as you all know, heat-related illnesses are really serious, especially in vulnerable populations. So that's something that trees really help with for our local temperatures. They're also critical for water quality. The map of squiggly lines is a map of our watershed, and those blue squiggly lines means healthy waterways, and it is absolutely interconnected and tied to how many trees are in that area. So the unhealthy waterways are where there are fewer trees and fewer canopy, and of course we need clean water for many different reasons. It's also just really good to be around trees for our mental health. If you think about what it feels like to be in a park, or even what it feels like to sit underneath a tree, usually don't feel stressed in that kind of situation. Your blood pressure goes down, your heart rate goes down. There's lots of public health benefits associated to mental health and tree canopy. So before the fact that we are, losing trees as a city, and yet they're so important for public health and environmental health, and of course these things are interconnected, this is why the Root Nashville campaign exists. So this campaign launched in October of 2018, and it is structured as a public-private partnership in itself. So Root Nashville is not a standalone organization or entity. We describe it as a movement. It's something everybody can be a part of, but the leads of the campaign are the Cumberland River Compact, which is an environmental nonprofit, and Metro Nashville. So this is something that our government is behind as well. And we work with a bunch of different departments, but especially our Metro Water Services Department, because that's where our urban forestry hub is located in Metro. We have a very big goal of restoring canopy as a city and as a movement and a partnership by planting 500,000 trees in Nashville by 2050. And this is to restore what is being lost and get us back to what we need to have a healthy community. So we've got this big old number, 500,000 trees, we've got this timeline, but really the why of why we're doing all of this is to create neighborhoods that are healthier, that are more equitable, and that are more climate resilient for the future. So this is why we're doing it. This is why we plant trees, is to have a healthier community. And what does that mean? What does that look like? Does this look like an area that is ready for the future as it gets hotter, and as we have more extreme rainfall events that we're predicted to have in Middle Tennessee? Does this look like somewhere where kids would want to play outside? Does this look like somewhere you'd even want to go get your mail in the summertime? Is this somewhere where you'd be likely to go on a walk with your dog? As compared to a neighborhood that might look more like this one. Where would you rather live? What looks like a healthier neighborhood? What looks like somewhere that is more comfortable to be in the summertime? Somewhere that's ready to receive more extreme rain and have healthier air, all these other things. So this is a partnership and a movement, and fortunately what helps me sleep at night with this very big goal that we have is that nobody is in this alone. It's very much a partnership-driven effort. On the Root Nashville campaign website, you can see where all the newly planted trees have been added and who's planting them and what kinds of trees they are. We're at close to 26,000 trees since October of 2018, so we're on our way. We still have a long way to go. But no matter who plants trees or how, if it's in Nashville, those trees can count towards this movement and towards this goal. So from the very beginning of the campaign, it does have a very intentional health focus and perspective. And again, that's the why of why we're planting trees, is to have a healthy community. So from the very beginning, we had this intentional health perspective, and part of that is built into our structure. So the campaign has an advisory board, and the local nonprofit Nashville Health is the chair of our advisory board. We're also fortunate to have Metro Health representative on that board with Tracy Buck, thank you Tracy, and have partnered with our health department on several kinds of projects, including different grant opportunities. We've had public input sessions in partnership with Public Health Department, and lots of other things, but it's really baked into our structure and what we do when we're planting trees. There's a lot of different partners in this effort. Again, that's what makes this goal possible, and all of these different partners have added and contributed towards this goal of, so far, almost 26,000 trees. I know our friends from Socket and General Services are here as well, so just want to highlight that, yes, it is led by the Cumberland River Compact and Metro, but there's a lot of different partners that are involved in this work. So we plant trees everywhere, but also really wanted to talk about our equity focus with the campaign, especially as that has been a really important kind of reoccurring theme of the conversation today. So we do plant all over Davidson County, but we do focus in these areas that we call impact areas, and that's because this is where the data shows trees can have the most impact and the most benefit. And I won't get into all the details of how we determined these impact areas, but several of those data points included where are there higher rates of asthma? Where are the neighborhoods that are hotter? So there were quite a few public health kind of statistics and measurements that we looked at to see where do we need to focus our tree planting efforts. So the campaign is a public-private partnership, and that is also helpful because those are different types of land that we are planting trees on. There's public property and there's private property. I'll just kind of go through this really quickly to just mention that these opportunities are out there, and if you want to learn more about any of them, come see me or go to our website. But 94% of Nashville's land itself is actually privately owned. So the vast majority of the land is privately owned. So we realized pretty quickly in the campaign that we're going to need a strategy to get trees to private property. So we have a program called the Neighborhood Planting Captain Program, which is an entirely grassroots program where neighborhood leaders tell their neighbors, hey, free trees are available. We deliver it straight to your yard. Here's how you sign up. Shout out to a neighborhood planting captain that we have in the audience, Carson Cooper, who's recruiting her neighbors in South Nashville right now, getting more trees in her neighborhood. We also have strategies for getting trees to larger sites like places of worship, HOAs, apartments, things like that. We try to make it as easy as possible. The bulk of this work, it's a very small team, but with lots and lots of partners, and we really, really work so strongly and rely so heavily on community members to lead efforts within their own communities. We try to make it as easy as possible by providing the materials needed to do so. And again, won't get into the details of this particular program here, other to say, check it out if you're interested. Planting season hasn't started yet. We get kicked off in mid-October, plant trees all the way through the end of March. Now is the time to get your projects planned. And what does this say? Oh, just want to also make sure, give a proper shout out to our Metro partners because yes, that's a significantly smaller sliver of land, just 6% of the land, is publicly owned, but Metro is very committed to this partnership and goal, has planted about 30% of the trees so far in the campaign, and that's just on that smaller piece of property. So I know that many of you might be connected to, maybe your place of work is public property itself, so wanted to name drop a couple people within Metro if you were interested in getting trees planted at your place of work. If your place of work is a health department or somewhere that is managed by general services, you can reach out to Liz to get trees planted. Other types of public property like street trees, you can contact Rebecca or you can contact me and I'll get you to the right person. So would be remiss not to leave with a call to action, and that is to say that we are in the very fortunate and unusual position of being funded. We have what we need to plant 500,000 trees by 2050 as of quite recently. So really our biggest need is getting more people involved, getting more sites interested, more people advocating for tree planting, whether that's in your own yard, if you're fortunate enough to own a piece of property and have a front yard or backyard, or if you have any sway over any piece of land that you might attend or go to, if you go to a church, if you are connected to a school, if you frequent a local business. We tell people all the time that means, hey, guess what? You are a steward of the environment. You have sway over that land and what happens there, and you have influence in what you do. So join us. This is our group of neighborhood planting captains and other partners. You absolutely do not need to be a tree expert in any way to get involved and to do this. And it is for the reason of health is why we're trying to increase our canopy. So I'll leave my email up there, and that's our general kind of inbox as well. But I'll be around today if anyone would like to talk more, and happy to answer questions later.
Thank you so much. I can definitely relate to the benefits. I actually hike like every weekend for my mental health and well-being, but I appreciate learning about this, and you just got yourself at least one more volunteer, so thank you so much. And I can't help myself because I'm kind of corny, but I just learned a joke about trees, so I'm going to share it. But what is a tree's favorite beverage? Root beer. All right. Now we're going to kick it off to Director T. Gonzales from the Louisville Metro Department of Public Health and Wellbeing, or Wellness, sorry.
Hi, good morning, good afternoon. I'm not sure exactly what time it is. My name is T. Gonzales. I serve as the director of the Center for Health Equity at the Louisville Metro Department of Public Health and Wellness. I'm glad to be here today. Here's some interesting projects and ideas kind of being batted around. Just a little bit of introduction about our health department. So the Center for Health Equity is kind of one of three major sections of our department. Around 5 years ago, we kind of made this transition. The center was originally established in 2006, but always kind of traditionally had a very small staff. So around 5 years ago, under the direction of our previous director, Dr. Sarah Moyer, started to make some realignment in our department so that now we kind of have policy component, our community engagement, our strategic partnership, a lot of our population health like data analysis, and our performance management components all under the Center for Health Equity, kind of working together to really transform our public health practice. And so that's how we're approaching things today. And I think when we're talking about health and all policies, it really, and as I think has been discussed here today in many ways, really rely upon those various skill sets around policy development and analysis and evaluation, along with the data components, the community engagement and strategic partnerships, all have to be working in tandem. So it's like kind of the benefit for us that all of those are housed within the Center for Health Equity. So our teams, our staff are, some of them may be different for them, but they get accustomed to kind of working more so in a kind of matrix environment and where they are kind of always collaborating with people and working significantly alongside people who may not necessarily be on their team per se, right? So we can't achieve any of this type of work without kind of having those skill sets really firmly established and then develop and kind of having committing to capacity building within those skill sets for our public health staff. I think that one of the interesting things for me, I think in our practice, right? So in our vision to achieve health equity and improve the lives of all of our Louisville residents and visitors, the practice of doing that when we're talking about health and all policies or trying to work towards health equity, for those in public health department, adopting a public health 3.0 model, we're focused on those social determinants of health, we're focused on strategic partnerships. The real challenge then, I think, becomes that we as public health practitioners, especially like located in local government, in a local health department, a lot of the issues that we're talking about, as have been discussed here today, so if we're talking about housing or transportation or education, fall outside of our jurisdiction as public health practitioners. So this is the real challenge, therefore emphasizing even more so our need to really focus on and build up those strategic partnerships and also be, I think, in some ways, the leaders, which we are trying to be in Louisville Metro government, the leaders for how we are doing authentic community engagement in a way that is not only about, I think someone said, providing updates or informing our communities, right? But instead having them be the drivers of actually what type of policy initiative it is that we ought to be undertaking. So for us, some of that has looked like trying to establish a community advisory board, which is different than our Board of Health, right? So I appreciate the work of our Board of Health, and I think it is fair to say they are not representative of residents, the whole swath of residents of our community, and certainly not residents who may be experiencing the systems of power like racism and classism and all the others as the most heavily negatively impacted in our community. And so therefore we have to make other models, other ways of being able to have our residents be able to have more access to decision makers and more access to decision making, right? So and it's a work in progress that we must do this. And so I think that's an important component, and it's a practice. Right, it's an evolving practice. I think somebody said, sometimes certain things that we try out may not work, but that's okay because we're trying to innovate our public health practice, and so we continue to do this, and we do it within the context of Louisville Metro government. You're doing it here within the context of Nashville, and those contexts, I think, may have some similarities, but they're also different. So then how do we then engage in where we may not necessarily, we may have a vested public health interest in addressing certain issues that fall outside of our jurisdiction. And I think some of it is indicative of what's been described here today and some of the partnerships that you all have. Some of that is about transforming our inward practice. I kind of think of our practice as in, out, and with. So our inward practice has to change. That's about that building up that capacity for us to understand what are the needs in our community, and do we have people who are employed in our public health department who are able to address certain policy issues and learn about analysis and evaluation and do that type of work. So we have to focus inwardly and building up our own equity framework and skill sets in order to put that into practice. And then I think about the outward component, right? So how are we connecting then to our residents? How are we building up very strong strategic partnerships, especially when we talk about some others have talked about inside-outside strategies. Sometimes our strategic partners and our residents are able to speak in ways that we cannot necessarily do. And so we are relying on them in order to, quite frankly, from my perspective, to apply pressure to local government, which may not necessarily always, because of politics, be able to come in the same way from us as a public health department, right? So we need that component. And then I think about the with component, and this is a part for those of us who are in local health department or across city government. How are we working with our other agencies in order to build relationships, and as the public health practitioner, then start to hopefully try to have some influence with other agencies who more likely have jurisdiction over some of the issues that we're talking about. And some of this then, in Louisville, we have a strong mayor form of government, so we're in the executive branch. So then how are we building a relationship with the Metro Council members, right? So some of that, even just this week, as we're looking at issues around how might we use our rental registries to talk a little bit more about the quality of housing, and then some of that, like if we can push it to really getting like a lead registry, right? Because we know that lead is a serious issue in our community, and we think probably the fullness of it not representative in the data that we have, right? So trying to push this. So how can we provide resources that we know about as public health practitioners to elected officials, right? So they can have a little bit more technical assistance to thinking about how some of how some of these advancements and policy are happening across the country. And I think that's where we have to use our relationship and kind of advance these issues. So those are some of the things that we're talking about right now about this. How do we utilize our rental registry? Maybe push towards how that might intersect with a lead registry in our community. Very early conversations about how to do that, but we think necessary. And trying to get, again, like I said, influence into areas where we may not be the only decision maker, right? Or the decision maker may fall totally outside of us, but how do we have influence there? We're having significant conversations in our community, I think many communities, talking about houselessness and the way that one of the ways in which that represents itself is in certain encampments in our community, right? And what are the public health needs there? And also, I think as policies are made and policies are revised, how do we push ourselves in our inward practice to drive a different message instead of having others who think they know what the fullness of a public health message is, right? So we'll have many people say, hey, encampments, people living in camps is not good for human health. Well, we don't think that that is the actual, like the full story, right? Also displacing people from where they exist, right, where they are living right now, right, can have actually other detrimental effects, right? And there are certain benefits. I mean, we have a behavioral health equity team that's also part of our Center for Health Equity. And one of the things we're trying to communicate to other decision makers in Louisville Metro government and also to the Metro Council is, listen, a lot of folks who are in encampments may also be engaged in substance use, and they keep each other safe, right? Knowing who is here and in my community, I'm able to maybe administer Narcan if I need to, right? They're literally every day, not just, it's not just maybe if. We actually have people who are saving each other's lives in that way. And so to disrupt encampments is not just a clear picture of like, oh, certainly to live in a camp is bad for human health. It's more complex than that. And we have to be able to speak to that as public health practitioners in raising some of the complexities. I'm listening to the story about the trees, and I'm thinking, our tree ordinance in Louisville got very political in ways that we were not anticipating. I mean, I think the city was not anticipating. But, it is true to say that managing and trees that are on your property can be very expensive. And we had lots of people in our community who may be living in neighborhoods that are the exact neighborhoods that could benefit from a lot of influx of trees being planted, saying, hey, we can appreciate what you're trying to do, but we're not able to incur the expense of the maintenance of these trees. And that's a very real thing. Last year, unfortunately, I had to have a tree removed from my yard because I was really worried that I think maybe this may be hitting the foundation. It's certainly moving my sidewalk, right? So really didn't want to, but personally had to remove a tree. And I'm thinking, I know exactly what that bill costs for me to remove a tree, right? So, or to have it maintained, people to come out to, whatever. So all these equity issues are also very complex. And I think we have to be able to hold that complexity as public health practitioners where we're talking about human health and all the dynamics of equity. And that's about continuously building up our skill set and our practice as public health practitioners. Thank you.
Thank you so much. That example of like the complexity part really kind of shines light on, there's so many angles to consider, so thank you so much. Just a quick update. We're going to end up skipping actually Q&A for the panel to try to keep on schedule and make sure we have enough time for the breakout sessions, which will follow directly after this. And so after we hear from Melody Gibson here in a moment, I just want to let you all know, if you go straight out and to the right, that's where you can pick up your lunch. And then if you could go directly across from that into the other conference room, that's where we'll organize the breakout sessions and have like a working lunch. Where we can all make some progress and collaborate together. But now, without further ado, I'll pass it off to Melody Gibson from the Civic Design Center, and I'm very excited to hear about your work helping our neighborhoods and our youth.
Great, thank you. Oh, clicker. All right, so like you mentioned, I'm Melody Gibson. I'm Education Director at the Civic Design Center, leading our 2 youth programs, Design Your Neighborhood and the Nashville Youth Design Team. At the Civic Design Center, our mission is to advocate for civic design visions and actionable change to improve quality of life for all. So we define civic design as community representation in how our cities and neighborhoods and communities are designed, planned, and built. At the foundation of the Civic Design Center, which was one of the organization's first major projects, was this widespread community engagement effort in order to create what we call the Plan of Nashville. And so it's a community-informed, long-term vision plan of design work to guide the city's growth and development. And out of the Plan of Nashville came the guiding principles for civic design that just provide like a framework and guidance that's specific to Nashville for how we should grow and develop. And one reason we felt like this was really important is because historically in Nashville, and of course, not just Nashville, across the country as well, urban planning practices have led to a lot of harm, specifically in communities of color. And so we felt like it was important to have guidelines to at least state this is how we do urban design for good. And so these principles cover a wide range of industries that we've been talking about today. We have principles about housing, transit, how to integrate health additions into a neighborhood, parks, the list goes on. And so, you know, of course, those in and of themselves are separate industries. And so we see this more of like an ecosystem of how a community needs to be made up in order to be livable and equitable and a place where people can thrive. And so we see the Design Center, since the beginning, we've seen ourselves as a connector among all of these industries to try to create collaboration and understanding, cross-sector, and also crossing over into the public realm. So how do we connect the public community members to the industries, to our municipalities, to all collaborate in order to have good design? I'm going to highlight a couple of our programs and then a project. So first, these are our two youth programs, the Design Your Neighborhood, which is it's a curriculum that's taught in metro middle schools that asks students to problem solve issues in their neighborhood that are impacting them, very hyper local. So problem solving issues related to walkability in their neighborhood and the lack of affordable housing available. And then we kind of consider that baseline knowledge for what we hope every youth will experience in their middle school education. And then we recruit from the middle school classes in order to have our Nashville Youth Design Team, which is a high school internship program. And the Nashville Youth Design Team, they focus a lot of their work on community research, specifically with youth, other youth. So they create tools for surveys and interviews and things like that. And they do outreach to youth all over the community, and then take that data and try and notice trends. And the data is specifically centered around, their framework is all centered around youth wellness. And so they've broken it down into factors such as recreation and social wellness, your intellectual wellness. And so they're asking other youth, how do spaces in your neighborhood support or not support these different areas of wellness? And then they have those categories and that data to go off of. Let's see, keep going in the interest of time here. There we go. Okay, one more program and then I'll get into a project. This is our Turbo program. It's called Tactical Urbanism Organizers. And so tactical urbanism just means a really fast, low-cost change to your environment that's meant to be temporary and experimental and inspire long-term change. So we have this program that takes ideas from community members and we ideate with them and get out and actually build or paint some type of change. And so the project that I'll highlight happened on Dickerson Pike, and we merged our youth design team and Turbo programs in order to do this project. And like I just mentioned, the youth design team bases all of their design work in data, and they were recognizing how much more youth their age want more walkable and accessible communities, so they don't have to depend on adults to drive them to work and things like that, or school. And so they decided to look at that issue and then focus in on Dickerson Pike, where they noticed that there was a problem of pedestrian deaths, which it's not just Dickerson, but that was the one that they decided to focus in on. This is a picture of a really typical street where people are regularly walking through this on Dickerson because it's a pretty highly trafficked transit corridor, where a lot of people in this community rely on public transit. To get to a stop, you have to walk through a ditch and you have to cross like a really fast or like huge 5-lane road. And so this is the area they focused on, specifically the intersection of Hart Lane and Dickerson. And they designed a tactical urbanism solution, which involved having so they kind of extended the shoulders there and painted a really brightly colored mural there, so it catches the eye of the drivers. It kind of notes that place as something special and gives more space to the pedestrian. Also, one of those crosswalks was not previously there to this, so they wanted to paint the crosswalk, and then NDOT came in and did it for them, which was exciting. And so there they are with their finished design. And I will note, just since we're talking about cross-collaboration, these were all of the partners involved in some way in making this happen. TDOT specifically, of course, had to give approval for something like this to happen on a state route. And this was the first tactical urbanism they had ever approved on a state route, was when the youth asked them if they could do it. They said no to us adults plenty of times, but in this case, we consider this like a systems change, because now we have this method of tactical urbanism we can use in order to inspire and get the community involved and engaged about these issues around pedestrian safety. And I will say now TDOT has recently said that they're going to invest quite a bit of money into long-term permanent improvements on Dickerson. So a complete street that's going to have, safer sidewalks and bike lanes. And that was spurred by the youth design team's advocacy, along with Walk Bike Nashville, who did a lot of work around mobilizing that community and really advocating for safer streets there. So that is all. And
thank you so much. That's powerful, and thank you for reiterating the power of youth and for leading the charge. Thank you so much. And thank you to all the panelists and to all of you for attending. And we're going to head out to lunch and do our breakout sessions after a quick round of applause for everyone. All right.